tracheostomy care to be performed on a patient, and judging by a recent respiratory assessment, they could also use some suctioning. So, first we need to check the orders and the policy, and next we need to gather our supplies. So for suctioning, we need a suction catheter, as well as sterile saline, sterile gloves, oxygen saturation monitor, and oxygen administration method. And for tracheostomy care, we need a spare inner cannula, disposable one, as well as cleaning supplies, so like gauze or cotton tip applicators, as well as sterile saline and absorbent pads. Okay, and then after we've gathered our supplies, we're ready to head to the patient's room. Knock, knock. Hello, Mr. Jones. How are you today? I'm your nurse, Mindy, if you remember that. And I'm just here to clean around your tracheostomy and replace the dressing and suction out some of your secretions. Does that sound okay? Alright, we'll get started. So first I'll perform hand hygiene. Next, I will don some clean gloves. And then I'll just perform a quick safety sweep of the room to make sure that there's an obturator, spare trach tube of the right size, and suction in case the trach tube falls out. It needs to be placed back in. So then, now I will ask Mr. Jones, could you please state your name and date of birth for me, please? Okay, thank you. And I'm just gonna check your wristbands real quickly. Now make sure that the bed is in a working height and that the head of the bed is raised no more than 30 degrees. And also remove this. Oh.
Yes. Are they saying that it's by suction with thumb suction? Yes. Does that mean I'm just like including and uncluding that?
And before we get started, I'm gonna place an absorbent pad over the patient's chest.
All the way down. All the way up. Head set. Okay.
Alright. So, first, before we get into the tracheostomy care, we will need to suction first. So, first we should open our packaging. Maintaining stability. Okay. Next, we will need to provide oxygenation for the patient, hyperoxygenate them before the procedure. So we will place the oxygen saturation monitor onto them and check it. And then now we will hyperoxygenate them with a few breaths from the amber bag at 15 liters. Just move this to the side. Just provide a few breaths, each one about 5 to 6 seconds. Hyperoxygenated. Press this back on quickly. Okay, now we are ready to start preparing for suction. So we need to make sure there's 80 to 110 milliliters or millimeters of mercury of suction available, and there is. And we need to make sure that we have our sterile saline, and we need to set that up. And then now we're ready. So we took off our clean gloves. Now we're going to perform hand hygiene. Move our box to the side a little bit. So now we will grab our sterile gloves. So we'll first put on our right glove. Left. Okay, and now the dominant hand, my right hand, will be sterile, and my left hand will be my clean hand. So I'll use my right hand to open up my sterile saline, and I'll place it onto the sterile field. And now with my clean hand, I will grab the section. With my sterile hand, grab the suction apparatus and attach while maintaining sterility. Okay, we'll move this oxygen out of the way. And now I will lubricate
was never got. So you gotta look at the schedule.
the tip. And now I will explain to the patient that I'm going to insert the suction catheter until I reach resistance or a cuff, withdraw 2 centimeters, and then engage intermittent suction on the way back for no more than 10 seconds using a rotating motion. And if in the event that the suction becomes too uncomfortable, the patient can just raise their hand to tell me. Okay? So I'll insert on 3, 2, 1, go. Okay?
Crutches.
So 3,
Another thing
2,
was a phone over there,
1,
which we still don't have. The other thing was somewhere for us to keep our
met
purses.
resistance, so now I will withdraw.
And
2
another one of the
centimeters.
things was
Engage
a bulletin
intermittent
board.
suction.
So a bulletin board here and over there.
No more than 10
We never
seconds.
got none of it.
Okay? And I'm just going to check
I'll tell you this.
the color and the consistency and the amount of the drainage. And then I will see how the patient reacted to the suctioning. And if I were to suction again, I would clear the secretions by suctioning sterile saline.
Yes.
And then
And all that
I
crap
would
in the mail.
oxygenate the patient again,
Last night.
and then
My
suction,
bottom
allowing the patient to rest for
10
a
pages,
couple
5 pages,
minutes
but it's
between each suctioning session.
So,
But for now, we're just going to discard.
I got them in Target, 6 for $1. You know their dollar bin when you first.
So we can detach
Look at this pocket.
the suction catheter and discard it.
And he was so excited. I said, okay, now we're gonna get crayons and pencils. So they just come
Okay.
running away.
And now we can move our supplies away.
Oh, Kitty didn't stay in the book. Oh, yeah. And not only does he line them up so safe,
And then
this is
now
our table.
I'm going to
And my
be
table is
clean.
wood and then has glass in the middle.
So
So it's almost like a road.
now we are going
Once
to
he
do,
lined, and he has a cup.
first we need to oxygenate the patient again.
Ones with big wheels, and then he has 6 that are all the same size.
With a few breaths.
They all have to be facing. So there's a lot of stuff, you know. So, but then he goes like this.
4,
Make sure
5,
that they're lined
6.
up. Oh, yes,
the
there is
patient's
a definite
oxygen
purpose in what he
saturation.
does. Last night he was very involved with his Duplo dogs.
Then now
So the
we are
first day
going
he came
to
to us, well, you know, he kind of like
change the
stuck
inner
him on.
cannula.
Last night he got,
So
the tower was
we're
this
going
big.
to take out the
And like you
dressing
could see his
first
eyes, like he was so excited. He was making this so big.
and
And
discard
then
them.
he's, my husband was helping him, you
And
know.
now we will take out
And
the old inner
He
cannula.
knows now if it doesn't fit, try a different one. Something, I was trying to see if he was looking at the colors,
And look
I
for
didn't
any
really see that.
secretions.
But he's like
And then
sneaking
discard
on
it.
his
But in this
toes.
case, we're gonna
So he can- and
reuse it.
then
So
jump up
just gonna
and
place it
so
over
excited
here.
that he made this big tower.
okay.
And with the therapist,
And
our
now we're
friend,
going
she
to
asked me,
discard
when
our
I had sent
gloves.
the original video of him lining up the cars, she says, what does he do if you take one of those cars out of the line? Or take one of those, does it have a fit? No, he don't care. He'll just pick it up another one and put it back where he took it. It doesn't
For
upset
hand
him.
hygiene.
So he doesn't do that, you know.
And
But
now we
then
are
he
going to
has-
open
I
our
have a little picture.
tracheostomy care.
My son John and Freddie, when they were, I don't know, John was maybe 10, so Freddie was 4, and we went to Nassau. And there's a picture that says, "In the Narrow Moon." It's just in a little picture frame like this. That's one of the first thing he does. He picks up that picture, he kisses, and then he hugs it like
So
this.
first,
And
we
then
will get
he doesn't know
our
that's his
sterile
dad, but I
gloves.
don't know if he looks at, no, because Freddie looks, I mean, he's only 4 years old. But then I have his army picture. I give him his army picture. He hugs it, he kisses it. So last night when we were FaceTime, he came in. He used to get, when we would FaceTime with my son, he would go, like he didn't want to look at him. So now he takes the phone and he flips it, then he puts it down here. My son saying, I don't want to see your crotch. I don't want to see your crotch. He cracks up, and then he flips it, and but he kisses them first. So he kisses his daddy now. Now he's okay with seeing him. But like I told Freddie in the beginning, he said he won't even look at me on the phone. I said, honey, he doesn't know how to express to you. I miss you, Dad.
and
He can't
now
verbalize those
we're
words.
going to
He
maintain a
can't,
sterile hand
so his
and a
he
clean
would
hand.
show it in a way that
So my
I
sterile
can't look
hand
at you,
will
it's too painful.
grab the
So yes,
cannula,
yes.
the new disposable inner cannula
But
from
when we went
the
to
outer
pick him
rim
up yesterday,
only
the
to
lady
maintain
who
sterility.
takes care of him, she doesn't speak English, but her husband does. And I said, you know what? I told Michelle, I said, we'll call you if we get there and we have any questions.
And lock it
I don't
into
understand.
place.
It was fine. He came
All right.
right to me. He took my hand.
And then now my
tight,
clean
squeezed
hand
my hand like this. But he was happy. He was happy there.
will
And
get my
he's
sterile
doing
saline and pour
I
it
said, wait,
into
Poppy's
the
gonna put
compartment.
his car seat in. So okay, then he's waiting. Then he saw Poppy. Then he gets all excited. And but he was ready to go. He was ready to go. We picked him up.
And then now I will discard the supplies that I
But I'll
don't
tell you,
need.
he is a piece of work. A big piece of work. He's a lot of work.
I'm going to put
really give him too
the
many things to play with at once. I said,
cotton
let's just
swabs
take out the
into
blocks.
the sterile
And
saline
then
and
if he
soak
gets
them.
bored with the blocks, he knows where his cars are. Then let him go get his cars and set them up however he wants. Then he was playing the piano. He was doing that last night. He had a lot of stuff. He was very busy with.
Alright,
And the tub.
now we're going
I
to
told you about the
use
tub. I was gonna have a tub in South Korea, so
the
he's not used to
soaked
being.
cotton swabs to clean around the
So he
tracheostomy.
finally now
With
he
a
gets
clean
in
hand,
our
just
tub. He
move
loves
the
water.
trach-
He loves
The
it. But
phalanges
now
a
he
little bit
sits
to reach
down and he
under.
plays with his boats and he fills them with water and he likes you to dump it on his head. He thinks that's the funniest thing. You know, most kids don't like water.
We're only going to use
because he's
each
so used to the shower. He likes
cleaning
it.
device once
And then he takes the washcloth
to
and he
prevent
throws that on his head. Okay,
contamination.
now wash your hair. And he puts his arms in his sleeves and he helps you put his clothes on, except when he's after the bath, he thinks that's like run around crazy time, you know, like he lays on my bed and he flies all over the place. I said, you're gonna come, and he's hard to hold on to. It takes the two of us to get him dressed. And then I'm trying to, that's why I got Vaseline and Desitin on his butt. Now I gotta try to pull up on it. It's ridiculous.
Right, and now we will dry the
So,
skin and the
anyway.
tube phalanges.
But he's so funny, and he cracks himself up like he thinks that's the funniest thing. My husband took a couple of videos of him and I were going back and forth, and he was just giggling and giggling. And then I looked at mine, I said, please don't get rid of that picture. I said, if you could crop me out of it, I said, it looked
Okay.
so horrible, the picture.
And then now we are going to replace the split dressing under the two phalanges, ensuring that the tracheostomy is stabilized. The tracheostomy tube needs to be stabilized.
When I lost 106 pounds, you could take my picture every single day of the week. I would pose, but then when it came back, so this is him building a tower. And he's talking away. Oh. She said to me last night, she said,
Alright.
his parents aren't gonna come from Korea
And
for a
then now
while,
we're
and
done
the
with that.
therapist, he's being evaluated for this
And
early
for the last
steps,
thing,
called something like
just
that.
every week we need to change the securement device, so that just involves changing the
He gives me
Velcro,
that look like, really,
attaching,
see, it doesn't bother him.
removing the Velcro on one side,
you know,
attaching the
which is
Velcro on that
something
same
I would
side,
think he'd forget.
guiding the string around the neck, and then detaching the old Velcro on the other side, and attaching the new Velcro on
So
that
when
side.
we FaceTime, I gotta take the phone in, so
Okay.
I can see his dog.
And after we're done, we just need to ask the patient if there's anything else we can do for them, and then take care of that. And then after we take care of that, we can now discard all of our supplies. We can discard our supplies. We can put the patient into a safe and comfortable position
Just 2 minutes.
and push the bed all the way down.
In 2 minutes. Oh, okay, so show me that. Wow.
You know who sent this to you?
No.
You
Okay.
didn't respond to it.
No, I
And then
just delete them. I don't even
now we
open them
can
when they're like that.
remove our gloves.
Because sometimes they say it's in spam and I get spam alerts, spam this, all this. There's one that says I could lose 90 pounds in 30 days. Like, what are you gonna do, starve me in a corner somewhere? There ain't no way that's gonna happen. It's slow and steady.
Okay, discarded our gloves, and now we can perform hand hygiene and leave the patient safe and comfortable. And then now we will document that tracheostomy care was done, as well as any secretions that were noted on the bandage or the inner cannula, and then also document that suctioning was done, as well as any secretions, and then document the patient's reaction to the suctioning. And we're done.
You owe,